let me tell you a little bit. So sorry for I had to restart my computer and install another OS, and that was a mess. But okay, I'm sorry for being late. Very happy to be with you, and sorry for delaying your lunch. So I'll be talking about the French Health Data Hub. The hub is a public interest group that was created about 6 years ago, and which aims at facilitating access to health data for public interest research. And public interest research, of course, is a very large notion. Of it, it allows accessing for private sectors. This main mission can be divided into several axes. We play a role in the governance. You see on the left, we have a secure state-of-the-art platform, and of course, we work a lot on data. As of today, we are supporting more than 200 innovative projects, meaning that we are really supporting at many different steps of their user journey. Let me go fast. Let me tell you first of all about the data. There is one database that plays a very important role for us. It's called National System Health Database, SNDS in French. It's not a clinical database, it's an accountant database. We're very lucky in France because almost everybody is reimbursed partially of almost everything, almost the healthcares. So this database is about the reimbursement. So we have in this database a footprint of all the healthcare pathways of everybody in France. So that's very valuable. We have basically it's made of three databases that are linked together. Here is the outcare database. So when you're out of the hospital, here it's in the hospital, and this is the medical cause of death. It is a very valuable database that has been used for many years for pharmacoepidemiology and pharmacovigilance. And today it is also used to be chained with clinical database because it doesn't have any clinical information. So basically, when you work on a clinical database, you don't have any information about the patients before entering the database or after leaving the database. It gives you all that information. So it's very valuable, and particularly for AI projects. So actually, this is what we call the main database of the SNDS. There is another part in the SNDS today that we call the catalog of the Health Data Hub. And the catalog of the Health Data Hub is a list of databases that have been identified of national importance and that should be ready to use on our platform. So it means it's copied on our platform. It is natively linked to this claim database that I just told you about. And for the hot data, for the data that are still live, it is updated regularly so that when you get an authorization to access the data is ready and we can open a secret space very, very quickly. This catalog involves 22 databases as of today, but every year it increases. We have rare disease national database. We have Alzheimer database. It can have images. It can have biotest. I mean, many kind of data. About the platform. So all the projects we are supporting do not operate on our platform. It would depend on the project. But for those, it's about 70%, we would open a secret space with the exact data they need or they asked for, they were authorized to. We are talking about pseudonymized data, or only pseudonymized data. So we took out the directly identifying fields. And then they can operate within this secret space. They cannot take any data out. They have to have validation, human validation for that, but they can operate from their laptop. In their secret space, they would find a list of softwares, some open source suite like the AI suite and so on, but also some private companies' softwares if needed. And of course, this catalog of softwares increases with time. So I said that not all the projects that we're supporting do use the platform. Basically, our platform serves two purposes. If you need big computational power, we are not going to have cluster of GPUs in all the data warehouses of all hospitals. Or if you need to, if you have a project that is with several centers, and you need to do some chaining. This is extremely hard to operate because you have to go back to the person and go down and chain all the database and so on. We industrialize this part. It is made out of the hub because in the hub we only access to pseudonymized data, but it has been industrialized out of the hub, and we are able now to link any database going back to the security number of the person. So this is also something that is very technical, and we feel like it's the role of a national platform. Apart from these two paradigmatic cases, we do not push people to use our platform. Here is an example of a project that was it's a success story for the hub. You have a startup. They are doing telesurveillance for pacemakers. They follow 50,000 pacemakers, and they wanted to develop AI algorithm to estimate the risk of cardiac complication, but they didn't have the label cardiac complication in the pacemakers. So we chained their data with the claim database. In the claim database, you see that somebody was hospitalized for cardiac complication. They trained their algorithm, and now the algorithm is FDA certified and certified for Europe and is deployed. We work with, I'm going to skip some slides. We work with data warehouse in hospitals. We are big lobbyists for that to have a network of interoperable data warehouses. This is the kind of projects we are supporting. So it could be led by big companies, startups, academics, any kind of stuff. We are very much involved into AI. As I told you, we are part of the national strategy for AI. This is one project very important for us for democratizing LLM, the use of LLM in the medical context. We are leading a project with 30 actors, 20 hospitals, 10 research teams specialized in NLP and health. And we are also have Mistral and another startup which is called Recital. And we are going to develop a lot of open sources deliverables in this project. Now, and these will be my last slides about Europe. I mean, you've heard, of course, about the European Health Data Space, and we play a very important role in this in the deployment of this new regulation that has been voted now almost, I mean, less than a year ago. Because we led this pilot project that was the pilot health data at EU. So that's the pilot project of the European Health Data Space regulation for secondary use. We are not involved into into primary use. Okay. So this pilot, the goal of the pilot was to test a lot of stuff and give some feedback to the Commission so that they would understand how to deploy in the best way the health data space. We had 17 partners, so we did several things. It's over now, but we did several things. We connected a few national platforms on the network. We opened a central portal that is able to where you can connect and send a query on the metadata about the data available on this network. So you could ask, is there any diabetics database and how they look like and so on. We also developed a unique form to access the data, so a form that would be valid for different countries. And of course, we ran some use cases, some concrete use cases to understand where the bottlenecks were and so on. So some of them went well, some of them blocked, like we had the genetic use case, and we were supposed to link genetic data with clinical data, and that was a nightmare. So we were a proof of concept to understand where the bottlenecks were, and I think we did a good job. We are involved in many other projects within this space, and we are leading this shaped project that you see that is about how the relationship between European Health Data Space Regulation, AI Act, and how medical devices involving AI could use this space and how we can help them from the development to deployment. So also, again, I mean, we have several use cases and we are going to publish some guides. And finally, we are also heading this direct grant that is a preparation to the European Health Data Space. So we are working with a lot of data producers in order to set up metadata catalogs according to a standard that we defined during the pilot. It's called Health DCAT. It's a standard that will be used by the European Data Space for metadata catalog. It's open source. You can find it on the web. So now we are actually putting metadata for 20 French database into this format. So that's the SHADE project, and I think I'm done. I did my best to make it short.
Emmanuel, I'm not sure if you can hear the applause here. But Emmanuel, before we go, and we are all pressed for lunch, and thank you so much for having the trouble to stay also with us here. We have two ministries of healthcare here in the summit. I will tell you the countries. It's Portugal and Cape Verde. They are here. I'm not sure if there are any more authorities from outside the UK. Health authorities are here, but at least two. And I know for a fact Portugal is just creating its data lake. Cape Verde is also aspiring to have a data lake like pretty similar to what you have your exemplary work. What piece of advice could you give to these other healthcare colleagues from these different ministries of healthcare?
Wow. There are so many. But the hardest thing, I think, and the real bottlenecks is to be able to onboard a lot of data producers on this common project of using health data, sharing health data. So onboard, it means several things. To onboard the data producers, you have to make him understand why he or she has an interest in being onboarded. What would she gain from that, or he would gain from that? And that's not that easy. It's not just the law that says you should share, because that's not a good incentive. Just follow the law, because they will share it, but they won't like sharing it, so it's not going to work. So they have to understand that it's good for their databases that will be accessed a lot, and they will be rewarded by that. So that's the first thing. Now, onboarding also means being interoperable. Interoperability is a very complex thing to operate, so it should start at the very beginning of a data lake. So thinking about the standards you are going to use, and onboard the data producers on these standards, so that they agree at the very beginning. Don't define your standards your way and then say to the data producers, okay, now if you want to join, this is what you have to do. You have to be sure that everybody agrees at the very beginning, so that you onboard everybody. That would be my advices.
Thank you so much, Emmanuel. I think we have to break now for lunches. We have to start soon after.
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare. Better diagnoses and treatments. Making healthcare smarter, one innovation at a time.
Venture into the frontiers of healthcare data innovation with the Health Data Forum. Welcome to the Health Data Forum's YouTube channel, your gateway to thought-provoking conversations, cutting-edge insights, and groundbreaking advancements in healthcare data. Join us as we explore the transformative power of data to revolutionize healthcare delivery, patient care, and societal well-being. Embark on a journey of discovery. Delve into healthcare data through our informative videos, featuring leading experts, thought leaders, and innovators. Discover how our global movement, Data First, AI Later, is building a strong foundation for ethical and impactful healthcare solutions. Experience the collaborative spirit. Be a part of our vibrant community of health data enthusiasts, where ideas converge, partnerships flourish, and innovation takes center stage. Participate in discussions, share your perspectives, and join us in shaping the future of data-driven healthcare. Stay informed about the latest developments in healthcare data through our comprehensive video library. Catch up on insightful interviews, thought-provoking presentations, and engaging discussions about the role of data as the backbone of healthcare transformation. Join us in shaping the future of healthcare. Let's harness the power of data to transform healthcare for the better. Subscribe to our channel today and become part of the Health Data Forum's mission and our Data First, AI Later initiative to make healthcare data work for everyone.